Morning, everyone. Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much, much more. So I'm just reviewing another study and talking about hormones and testosterone specifically and its benefits and some different topics that aren't commonly talked about as much, right? So I like to mix it up. So this is a journal in the Journal of Clinical Endocrine and Clinical Medicine, JECM. I totally said that name wrong, but it's called the JECM. But basically had to do with testosterone. I like to talk about testosterone outcomes, benefits for men and for women. So what's commonly forgotten and misconstrued is the metabolites of testosterone. And what we found basically is that many of the beneficial effects are actually mediated by the downstream metabolites. And two of the big ones are estradiol, what I write as E2, and DHT, dihydrotestosterone. So especially with the change to testosterone, these are what basically cause a lot of benefits on the body, especially from a metabolism and overall health and longevity perspective. Specifically things like improvement in bone mineral density, preventing osteoporosis, osteopenia, sexual function, erectile function, and sexual function and performance in women, sexual desire, libido, sex drive, changes in hemoglobin and lipids in a beneficial way. And decrease in fat mass and improvement in overall metabolism and improvement in HDL with a quote-unquote good cholesterol, right? So basically a lot of these benefits are from the estradiol. They've done a lot of studies comparing testosterone and estrogen, and they block the effects to see what happens. So yes, testosterone of course has more ergogenic effects in terms of strength, muscle mass, etc. But a lot of the effects that have been attributed to testosterone, specifically what I hear all the time, especially with men, is like my sex drive's down, my libido's down, or I'm getting fat. I'm going to get bitch tits, right? I'm going to get gyno and all these things, right? And cholesterol, and bone, these all actually come from the estradiol component. When you block the estradiol, these effects go away. So the effects on fat mass, actually burning the fat, actually comes from mostly more from the estradiol. Bone mass, more from the estradiol. Heart protection, which I did not write on here, cardiovascular disease, right? That is definitely coming from the estradiol. Its effect on lipids, inflammation, and overall metabolism comes mostly from the estradiol, right? Obviously testosterone has a component, but a lot of the effects of that are coming from its downstream conversion to estradiol. So this is the common myth about this with fat. I'm going to get fat if I'm on estrogen. I'm going to get, gynecomastia. I'm going to get erectile dysfunction. It's actually the opposite. Now, of course, extremes of anything, right? Way too low, way too high. That's what you want to avoid. But in general, when you block estrogen, men get fat. They get erectile dysfunction. They get thin bones. So anyway. The other metabolite is DHT. And this is actually a lot of the benefits from metabolism, sexual function, muscle strength, muscle growth. A lot of this is the definite anabolic component, even more powerful than testosterone. So, which is why you don't want to block DHT. A lot of men are on hair growth products or things that block DHT conversion, and sometimes they have issues with this. They don't get the effect anymore. That's why DHT is a powerful downstream metabolite of testosterone, where a lot of these anabolic benefits come from. So very, very important for this as well. And again, all these chains are blocked. If you block this, if you block DHT, if you block estrogen with an anastrozole or an AI, you're going to get this. So don't block the estrogen, don't block the DHT, because then you're going to mitigate and you're going to lose all these beneficial effects. So that commonly gets forgotten about and misconstrued. So anyway, hope you enjoyed this. Please like and share this post. Remember, doing telemedicine all across the country. DrEricPrimax.com, doing health and performance optimization and muscle medicine completely above and beyond. I'm going back, basically getting you back to health, back to nature. We're going against kind of the mainstream stuff that you see out there. So many mills and clinics and gurus out there that just kind of do the same thing. My programs and protocols are above and beyond, taking you to deep level medicine, above and beyond what most people are doing. I'm taking you deep into everything: genetics, gut, microbiome, epigenetics, hormone optimization, lifestyle, nutrition, fitness, and much, much more to optimize you, to make you the best, to make you as prime as possible. So everyone have a great day. Reach out to me if you want to work with me. DM me below. Like and share this post. Remember to do something nice for someone today. Pass it forward. Live to give. Everyone have a rocking day. We'll talk to you soon.